Hi guys, today I want to tell you about the vagus nerve, but I actually want to show you a very specific route that reflexologists can use to trace that nerve pathway. I'll show you where it is in the body so that we can relate to that to the little body of the feet. So I can show you the reflex pathway in a way that'll make more sense to you. So first of all, the vagus nerve is the 10th cranial nerve, and how we would generally work with it as reflexologists is we work it via the solar plexus because it has a major role in bringing the body into the parasympathetic nervous system, or rest and repair. One of its huge jobs is to actually decrease inflammation in the body, and of course as reflexology therapists we would have a lot of clients with inflammation, but it does have some other jobs as well, including regulating organ function. So one of the organs that it regulates function for is heart. It helps to regulate the heart rate, it helps to regulate breathing via the lungs, it also helps to regulate digestion. So those are three major areas that it helps influence organ function. So what I want to show you is where it exits in the body is via the skull. Now it doesn't come through this major foramen magnum here, it actually goes through the jugular foramina. There are two of them, so here they are here, they're really big holes. And so that one is where the jugular vein comes through, but also, so some veins, some arteries, a few other cranial nerves drop down, but it's the longest and the major cranial nerve that drops down through there. So as it comes between the occiput and the temporal bone through those two holes, there are actually two branches of it that then drop down. So they essentially go down either side of the neck on the inside, and they drop down on either side of the esophagus, the larynx and pharynx. And so it's in this area that it starts to innervate the heart and the lungs. And so you can kind of go from, as a reflex pathway, you would go from the center of the big toe on the bottom out to the sides in zone 5 of the big toe. It does actually supply some sensory nerve to the ears. So if you can imagine the ears being on the outside of the head, if these two toes together were the main head and neck reflex, and here would be the ears. Okay, so you can go from here, then you would trace down the side of the neck, so zone 5, where the throat would be, and then you can actually carry on tracing that down between zones 1 and 2 as long as you're up in the thorax area. So this is happening on the dorsal aspect of the foot. So this whole thing down the side of the toe in zone 5 and then of the big toe, and then dropping down between zones 1 and 2 along the feet between the first and second metatarsal. This is where you're tracing this thoracic branches of the cranial nerve 10, or the vagus nerve. And here is where in the body, if it drops down through here, supplies the chest organs, it actually goes through, it pierces through the diaphragm, and then this is where we would work the solar plexus. So we would now shift to the bottom of the foot and go to where you normally operate for solar plexus. Now if you want to affect the vagus nerve specifically, but you want to do it according to organ function, then just work on those organs as reflexes, but think about the vagus nerve. Just make your intention very clear, but you would work on the heart reflexes, the lung reflexes, and then beyond the solar plexus, just work on the abdominal organs. And if you want to just do a sweep through the arch of the foot, that would cover the abdominal organs while you're intending on influencing the vagus nerve. Okay, so the missing piece for us, or the additional piece for us, might be the side of the toe of the main head and neck reflex, down the sides of both toes, and then between zones 1 and 2, between the first and second metatarsal, as long as you're in the thoracic area, and then move yourself to the bottom of the foot to solar plexus and carry on via the organs that it supplies. Hope that helps.